And I just kind of had this, I came home from this one meeting and I was just like, I can't do it. My husband was at a meeting for his work that night. And without telling him, I updated my resume and I sent it off to a DPC doc about 30 minutes from here. I had to fight really hard for that. But I was like, no, my contract says I can do this. Billy has an ear infection and I can swing by on my way home because it's half a mile away and just look in his ear and hand you a bottle of amoxicillin. I realize I've always had so many people to blame things on in corporate healthcare. And now I'm like, I have nobody to blame but myself.
Welcome to DPC Life, the podcast where independent doctors share real stories, bold ideas, and the freedom of doing medicine on your own terms. I'm your host, Dr. Ann Gonzalez, and together we'll explore the wins, the struggles, and everything in between. Let's dive in. Hello, and welcome back to DPC Life, the podcast where we talk about all things DPC in the office and beyond. And I wanted to wish everyone a very happy new year. 2026 is already here. Cannot believe it. I have some awesome news to share with you. I'm very excited about this year. There are some really great podcast episodes that are coming up, including more coaching episodes, and also we'll be talking with a few people outside of the medical field that have some insights and services that can help DPC doctors. Also, on February 21st, along with my partner, Dr. Rachel Kelly, we will be hosting a mini mastermind at our office in Hickory, North Carolina. We're going to have a small group of women physicians, a small gathering of women physicians, mainly from North Carolina, but if there are any physicians that are about to launch their DPCs in surrounding areas, if you're within a few hours drive of Hickory, you are also welcome to register and join us. So that's coming up in February, and you can find more information coming up soon. But today, my guest is Dr. Alisa Awtry. She is a family physician. I'm hoping that 2026 will bring a whole lot of change, but good change to all of our listeners. And let's get into our episode for today. Well, today I'm welcoming my guest, Dr. Alisa Awtry. She is a direct primary care doctor in Newberg, Oregon, and she's opening her DPC in January. It's called Rooted Direct Primary Care. Thank you for being with me.
Thanks so much for having me.
So first we're going to go through what brought you to direct primary care. How did you find it?
I actually was thinking about this laying in bed last night. I can't remember how I first knew about it, but I've been fantasizing about it for a long time. I thought this was a fairly new idea in my head, only a couple of years. And then one of my friends recently reminded me that we had gone to FMX together in 2022 when I was between corporate jobs. And I went to every single DPC session that was there. And she was like, no, you were totally obsessed at that point. But at that point, I also had a newborn and was not in a brain space that I had the space to think about it. And at that time in 2022, we moved from Northern California up to Oregon. And I was just totally overwhelmed. I was like, I'll just get a corporate job. It'll be fine. Just like the last one was fine. And so just put my head down and have been in this corporate job for 3.5 years. And thought it, as far as corporate jobs go, it was good enough. I was surviving. And then in April of this year, a bunch of new things happened at work where it was just, you need to see a lot more patients. You have a lot less support. You're not going to get paid any more money. Just do it and put your head down and keep going. And I just kind of had this, I came home from this one meeting and I was just like, I can't do it. My husband was at a meeting for his work that night. And without telling him, I updated my resume and I sent it off to a DPC doc about 30 minutes from here. And I was like, I don't know if you're hiring, but, and he called me like 8 minutes later and he's, I'm looking for somebody. We talked for an hour. And within a week and a half or so, I had a job offer. But as I went through the process, and his clinic is great and what he was offering was wonderful, I just really felt this like, Newberg are my people and I can't look at them to drive to this much like higher socioeconomic community and take care of those people. Like, I just can't do that. But it felt really weird to say that to him. And I did. And he was kind of like, it's not a big deal. Like, it's not that far. Your patients can drive. If they like you, they'll come. And I was like, you don't understand Newberg. Like, these people don't want to leave Newberg. We're here. And actually, right after I got off the phone with him, like 20 minutes later, I ran home and was taking my kids to soccer. And my husband was in the car. as we were leaving our house, there were 2 cop cars parked outside of our house, which was really weird, or like across the street. And so I kind of rubbernecked and I saw that they were standing next to this elderly lady. And so I looked a little bit closer and it was my patient who has dementia and was in the middle of a manic episode. And she lives around the corner, but she's homebound. So even though there were a bunch of neighbors there, nobody recognized her. And I was able to jump out of the car. My husband drove the kids to soccer. And I could say, this is so and so. She lives around the corner. I called her daughter. I called her husband. And it was just one of those really sweet, I mean, it was like a terrible situation, but like, no, these are my people. These are my patients. Like, I need to do this here. So for a little bit, I thought, oh, well, I'm probably just stuck working for the system because I'm certainly not going to open my own practice. And then over the several months, I was like, okay, I guess I can do this. I'll just go for it. And now here we are.
Well, I
going
think
for
it's
it.
wonderful to be working and living in the same community. It's some people are afraid of it, like they don't like it, but me personally, I don't mind it. But I guess it's just a personal preference. But I love that you're tied there, and you've lived there for how long? 3.5 years.
Just 3.5 years. But my husband's a pastor in the community. Our kids go to school here. Like it's just when we moved here, we kind of created our life of like we get a do-over, so we're going to do this all in a 2-mile radius, and our life is here.
Yeah.
So
well, that's
really
wonderful.
Sweet.
Yeah.
Yeah.
Okay, great. So you're opening very soon. Do you have a date?
January 20th.
Okay.
I'm still currently employed until January 8th, so it's a pretty quick turnaround.
Yeah.
Yeah. Right now, I'm doing pre-enrollment and doing meet and greets all day, every day on my day off, and then.
So, did you have a non-compete?
I don't have a non-compete. Yeah, so that was something I like looked at pretty carefully because I knew there's no other game in town. So I knew if I have a non-compete, I'm at this job forever. There is a clause that I couldn't tell my patients where I was going unless I had direct written consent of my practice, but that they weren't able to withhold that if my request was reasonable. So there was about a 45-day period of them withholding that, but I finally was able to remind them of the terms of the contract, and they gave it to me. And actually my letter just finally went out yesterday, and that's been a little boost of interest.
That's great. Oh yeah. Some places don't even say. It's like you just fall off the face.
Yeah, I had to fight really hard for that, but I was like, no, my contract says I can do this. And
good. What things are you wanting to talk about as far as opening your practice? What things do you need help with?
I guess 2 things. One is I feel like my elevator pitch just changes every day. And I don't know if that is because I really am like a family doctor at the root. Like I don't have a single ideal patient. If my panel ends up filled with all people who look the same, like that would be hard for me. And so I feel like it changes based on who I'm trying to recruit. But I feel also like my wording around it's a membership-based practice and we can see people with any insurance because often turns people off. Like when I have that little quick blurb in the exam room, they just kind of shrivel back, oh, it's one of those. And so I'm hoping to just work on refining that verbiage. And then I guess around like I just opened pre-enrollment a week ago and it's been pretty brisk, which is a great problem to have. And I have many dozens of meet and greets still to go, which is a good problem. But I guess I would love your insight on like how many pre-enrollments is too many in the sense that I want people to have a good experience with onboarding and how to help that process be smooth.
These are good problems.
Yes, it's true. I will say, just for piece of context, I got a really lucky break in that we have like a grassroots newspaper here. It's a one-man show, kind of like the DPC of newspaper almost. And he got wind of this in early November and asked to write a story. And it's a free newspaper that goes to like 6,000 people. And that one drove a lot of interest, but also I've noticed that the people who read the article totally get it. Like he just did a great job of explaining DPC, and I'm like, that was the best free advertising ever because not only have they heard of it, but they like get it.
That's amazing. I think you know how you're just talking about when you explain things to people and they kind of shrink up, like they hear no insurance. Mm-hmm. You need people who get it. Like you said, they just get it from the very beginning. Because it's very hard, and I wouldn't say it's a complete waste of your energy to try and explain it to people, because there are some people who after a little bit, they're like, oh, okay, I get it. But the ones who get it immediately, those are your kind of people.
What you're saying is I shouldn't be spending too much energy trying to get them to get it. They're either going to get it or not.
Exactly. Yeah, if they get it immediately, fantastic. There's some people who you can talk till you're blue in the face, and they're like, I have my insurance, and That's
And
good
it's good
Yeah, it's
insurance.
good
Yeah.
insurance, and so I'm not going to pay more. So
Yeah.
yes, exactly. That's what I'm trying to
Okay.
say.
I was hoping for the magic. I was hoping for the magic word that would get them to be like, "Oh, I see the value to
Yeah,
me."
yeah,
Yeah, because I have so many patients like, "We love you. We're so sad. We don't want to lose you. Are you sure you can't work here 2 days a week?" And I'm like, "It's so much better there." Like, just
yeah. And that's a hard thing. It
yeah,
is because there are people that you've seen for 3 years and you don't want to
for sure.
leave them. And there's a lot of there's a lot of guilt feelings, I think. And
Okay.
it's just something that you
Yeah.
have to realize it's not for everybody, right? And even though you do want to take care of everyone, you really can't as a direct primary care doctor.
Right.
But your people are finding you, it sounds, and they will continue to find you. So
Yes.
you're still going to be serving your patients. It may not be the same exact patients that you were before, and some of them will follow you.
Definitely have gotten people who followed.
I wrote down a few things. So we want to talk about the elevator pitch and then kind of focusing on who is your ideal patient. And then also talking about onboarding, how to onboard. It sounds like a lot of people at once. You want to give everyone the
Mhm.
time, but you don't want to overwhelm yourself either. Why don't we start with your elevator pitch and just kind of try it out? Let's hear it.
Yeah. So I feel like it always starts with, are you going to see people who take X insurance? And so I've changed it to say, I can see people with any or no insurance, but you aren't billed for any visits. And instead, you pay a low monthly fee that covers any visits you need. The membership then gets you direct access to me, your doctor. You'll always see me, longer visits, and same or next day access for acute needs. And that gives us time and space to really develop a relationship that allows us not to address what's going on, but also to develop strategies to prevent issues before they come big.
You've got
Yeah.
really good points. I'd probably try and shorten it a little bit.
Yeah.
So it really depends on who you're talking with, right? So try to feel out what is their pain point initially. So is it they can't get in to see you, or they see somebody different every time, or it's 2 weeks before they can see you, things like that.
Okay.
So if you can feel people out and then tailor it to what their concern is. And so most of the time it's going to
Okay.
be access. They can't get in to see you, or is the practice where you are pretty big right now? Like
Yeah.
they can't either get in to see you, or they get in and they see someone different that they've never seen before, right? And then also sometimes people are focused on cost, right? But if they have a high deductible, you can also explain, even if you have a high deductible, and also that HSAs this year. Yeah,
Are
you can
covered. Yeah.
use that as
Yeah.
another selling point. But I think really the emotional kind of things are probably the best way to
Better.
get people kind of invested and interested.
Yeah. What do you say to I don't see the doctor that much. I don't know if it's worth. I had a patient yesterday who is going to sign up for parent that I take care of, but then was like, I only see you once a year, and do you have an annual visit charge, or can't imagine it's worth it to pay every month.
So sometimes what I'll do is I'll say, even though you feel like you don't see the doctor, all the time, if you have small questions, what you're doing is you're probably saving it for your annual. And then by that time, you've probably forgotten. And then after the appointment, then you remember it. So we're available to take care of those things. And the reason why we like the membership is so that you have the access and you don't feel like you have to wait. And some of those people are the ones that you just will never convince. Because if they're saying that after you've already kind of given your spiel,
Given them
yeah,
they don't see the value.
Right. And maybe after she enrolls her mother and she sees how easy it is to get answers and how to get in with you and get responses, that might convince her. But again, it may not be worth the energy.
Yeah, good point.
It's just one of those things that you kind of have to get used to it and realize, again, it's just not for everybody. Not everyone's going to get it, and that's okay. It's okay.
Okay. I will believe you.
It's okay. There's people that you're like, oh, they're fine. I don't really want to see them anyway.
Yeah, no, those are this new doctor.
Yeah. So it's okay. Yeah. A lot of it is kind of just self-discovery and understanding and trying to Yeah, it's growth. It's a whole growth journey, right? Because
For sure.
all of it is
Yeah.
new.
No, I've always been, my parents were small business owners. And so my takeaway from that was like, I will never do this because I will sell myself to the man to have a paycheck every other Friday. And so to sign up for something where I'm not getting a paycheck come Fridays in January, yeah, it's a
Yeah,
lot of
it is. It
self-discovery.
is. And
So
it'll get better as you go along. It gets better. But it is a lot of learning and just adjusting and kind of that mindset shifting. So, elevator pitch, it will vary. It depends on who you're talking to.
yeah.
Now, I tell people this all the time because it is really easy, especially if you don't know somebody. You don't, like if it's someone that you're just meeting, to make it really, really short. It's my formula that I use when I talk to people. So, I say it's 3 parts. It's, when you call your doctor and you can't, you may have heard this already, but when you call your doctor and you can't get in, and they're like, oh yeah, I can never. Yeah, that's a pain in the butt. It's really annoying. Then you say, well, at my practice, we have same day or next day appointments, and we can see you when you need us. It's super short. That can be adjusted. When you go to the doctor, you get 5 minutes, and you don't get to talk about what you want to talk about because they're always talking about screenings or just whatever. But that's the idea.
Yeah.
You can't get enough time with your doctor. At our practice, we have 30 to 60-minute visits. So you get to really get to the root of the problem or what you want to discuss. When you have it shorter, it's just a lot easier. You just want to kind of get the attention and then kind of go from there. And I understand, like, our website, when we first opened, it was just like we were just me. I was trying to cram so much into it, and it was just too much. And we switched, and the people who redesigned it like took so much away. And afterwards, I was.
A friend helped me with my website, and she did so much of that. I was like, nope, you think your bio is great, and it needs to be half this like just.
Yeah. So, yeah, it was a lesson for me. Just stop. Just make it very, very simple. Okay, so that's something to work on. The elevator pitch, trying to make it simple and short, catch their interest, and then you can kind of go from there. Okay, so then what about your ideal patient?
This was really hard for me because I really am a family doc. I like it all, almost all. But I would be sad. My husband made a really wise observation when I was kind of first starting the ideas around this practice. That was every time I've limited my scope in my career up to this point. I used to do OB, and when I cut that off, I used to have a really HIV heavy practice, and here just doesn't have the community to support it. It's really decreased my joy in work. And so I'm trying that to heart, that like I really just regret. And so, and also like I love geriatrics, complex geriatrics, and my price point cannot support a panel full of complex geriatrics. So I'm hoping to have some of those that I'm like really just basically charity care. Like it won't pay for itself, but I enjoy it and I feel like it's meaningful work to me. When I built the practice, I feel like I was envisioning, like in terms of the access to these sorts of things and like having meds on site and being able to do a home visit if I need, the young family of working parents with a bunch of kids who like Billy has an ear infection and I can swing by on my way home because it's half a mile away and just look in his ear and hand you a bottle of amoxicillin. Like, and I'm not advertising that because I've listened to all the advice. That's terrible. But like that to me, terrible for like life and fitting it all in. But that to me is like the pinnacle of what I didn't have that I would have loved. I'm doing a like 4th trimester package of all in home care. Again, just because that sounds dreamy to me. Can I do that? Can I have lots of those people? No, but hopefully that will drive some babies in my practice. But, you know, I'm also like work out with a bunch of perimenopausal moms who are like my ideal patient of like having time and space to talk about bone health and dementia, all the things that get ignored at this age, that this is the time to talk about it. And I would be sad if I didn't have a good chunk of those too. So that's where it's hard for me to define who my patient is because I just want them all. Not all of them, but I want some of all of them.
Yeah, you have a lot of favorites.
I know, it's really bad.
It's not bad. It's not
That's
bad.
why I'm a family doctor. Like,
right. It's not bad.
You know, I paid for it all. Like, I want to use it.
Okay, so you paid for it all.
No,
I
I
was like,
trained for it
well,
all.
you
I
did
trained
pay for it
all.
too. You did.
I also did pay for it all. Yeah.
You paid a lot for it.
All of that. Yes.
So, one thing is right now, like try to think of your favorite patient. Like when you see them on your schedule, are like, oh, great. I'm so excited I get to see X today. Like, who
Yeah.
is that person?
It's a multi-generational family for
Mm-hmm.
sure. It is like the mom of the multifamily, where I know all the
Mm-hmm.
pieces of the
Mm-hmm.
puzzle and is like stressed out and overwhelmed and just needs a safe place that is
Yeah.
hers in that moment. Yeah.
So it sounds like you probably want more of them. People like
Yeah.
her. That's and that would be an
Mhm.
enjoyable practice, I think, especially since it's not just one type, because you said it's kind of a multi-generational family. Where do you find these people? Where do they hang out?
Yeah. So, I mean, I think I have good access to them, right? Because of already at school, like I take care of lots of my kids' classmates and their parents and their
Mm-hmm.
teachers, and our church is
Mm-hmm.
full of my patients. Our fields, Newberg, I feel like is pretty. Those places, people are, yeah, a lot of places that the like organic, the gym where I work out is full of these people. It's been hard, and so people are starting to hear about it from the article and from just word of mouth. I'm doing the community center where I work out. They do a like fitness sampler in early January
Mm-hmm.
for New Year's, where like all the classes have back to back, and they have a little health fair. So I'm like going to do a table there. It's been hard to like find in a professional sense how to get to these people. I've been doing mainly like the chamber and those sorts of things, and those are not. I mean, they'd be fine, but they're not like this patient that brings
Mm-hmm.
me a lot of joy. Yeah. So yeah, I don't know other than like the health fair and just conversing. And now I have a lot excited. The person who did my website, she is a mom for my kid's school who this summer I kind of like we were out to brunch and I mentioned like, I don't know, I'm thinking about this, but I'm really unsure. And she's like, we need this. Newberg needs this. Like, what do I need to do to make this happen? Because I need this in my life. I'll make you a website, you know, and
Nice.
she just kind of and she's tells everybody about it and we work out together and so she gets the word out. So I feel like that organic piece is happening, but I don't know if there's other ways more formally and like
Uh-huh.
professionally to
Uh-huh. Right. Yeah.
target those people. Yeah.
Okay. So definitely the gym, for example, you're going to do the health
Mm-hmm.
fair. Would they be open to maybe before or after your class, like just a 5 minute you talk about your practice?
My teacher is of one of the class that I do multiple times a week. I should be there right now. She's a physician and my patient and loves me and tells everybody about me. So like it happens organically, but I intentionally haven't asked for that formal thing just because I don't know. It feels weird in a yeah.
Why does it feel weird?
I think we have my own issues. I don't I don't know. Because it's like a private enterprise coming into a but maybe that okay, is that should that
I
not
mean,
feel weird?
it does, I guess, but why? Like, who's telling you it's weird?
I, that's that's a great point. I don't know. I guess
I
okay.
understand. I mean, I kind of get it. But also, if you ask and they say no,
Then
okay,
great.
you know.
Yeah.
Yeah.
Okay.
Hmm.
Fair.
And if there are other places, so let's see. So that's one place. You said you've been to the chamber. Do they sponsor any kind of talks or?
Yeah, so they have like greeters Friday morning where and you can like make
Hmm.
announcements. You can also like sponsor a whole talk. I'm gonna do an open house in January and advertise it to them. So I'm hoping I'll get some of those people. Yeah, but other than like your 30 seconds or a minute, if you ask for an advertisement, you can do kind of like a minute spiel. It has to be something more of like a
Got
whole
it.
event
Okay.
to put
Yeah.
on through the chamber. Yeah,
Do they have a directory where you can reach out to people in the chamber? Yeah.
they do.
And in the
Hmm.
chamber, are there any businesses that would cater to the people that you want in your practice?
For sure. Yeah, I've been meeting with some like physical therapists and a chiropractor, and I'm meeting with a naturopath. I don't know, sometime soon. And so, kind of meeting with some of those sorts of people, and that has actually been pretty helpful. I've had a few patients through those referrals already find me and sign
Fantastic.
up. Yeah. And then there's another woman who works for the hospital in the next city over who's been very helpful in kind of getting me connected with people that I met as well.
Good. So when you are communicating with them, how often are you talking to your referral sources?
Probably not enough. I like met them all for coffee, and then I like see them at chamber events and try to,
right.
But I'm nothing formal.
Yeah. It may be worth it to like every 1 to 2 weeks, just send out an email or a text, say, hey, how you doing? Just checking in. Can I do anything for you? Not necessarily you're asking.
Yeah, some of them are doing that to me because they're on it. Yeah, I should probably do the same.
Yeah, it's again, it's like that. Well, it feels weird, but is it really? I mean,
yeah, they've been super supportive. It's been really amazing. So yeah, I should be a little more intentional about those relationships because I feel like I've just been like, oh, I have them. They have my business cards. They know the spiel. They know which of them be good fit done. But I should probably make sure that I'm.
They do know it, but you just have to keep reminding them. And particularly, I mean, you can say, like, if you have any patients who are moms in the blah, blah, blah age and they got families, those are perfect. I love treating families like that. Next time they see somebody, they'll be like, oh, did you know? Dr. Awtry. So just trying to just kind of reach out, nurture those relationships so that it's just automatic that when they see somebody that would fit in your practice, they can tell them and identify it. So just go through your chamber directory, and even if there's people that you haven't reached out to, it's a good thing to just say, hey, if you've met them before, like just in passing at the chamber, nice to meet you. Let me tell you a little bit about practice. It is a lot. It's a lot of work. I mean, the whole thing is a lot of work.
I think I've been giving myself a pass because I'm still working my full-time job of like, I'll do that stuff later. And also like, especially with like the article that went out, I feel like everybody kind of got aware of this and now I need to continue. So
the person who wrote the article, do you know them?
I met him on the phone for an hour when he interviewed me, and then he came out to take my photo.
Have you talked to him much about like kind of the response that the article got? Like, has anyone reached out to him about it?
Oh, that's a great question. I mean, I like thanked him for it, but haven't. No, not widely.
It may be worth to see kind of what response he got. Like, what if people responded and said, "Oh, this really resonated with me. Oh, that's great." Seeing what people liked about it, and then also just keeping in touch with him because he's obviously a big supporter, and maybe he can do a follow-up or just like a little blurb just to say, hey, January 20th, practice is opening. Still.
Yeah. He posted it on Instagram, and there were like some pretty great conversations in the comments of just so many people. My letter hadn't gone out by that point, so like a lot of my patients being like, wait, this is she's leaving Providence, but she's such a great doctor. But also just a lot of people being like, I read about this and this, because there's nothing like this nearby. Like our community has needed this for so long, and it was the encouraging little conversation, which
that's awesome.
I was happy for.
That's great. So those people who did post on Facebook and commented, they may be people that you can just reach out to, say, hey, thanks for your comment. I appreciate your support. Can I tell you more? Or because they sound like they would be really good supporters, and social media obviously is a huge thing when you're trying to spread the word about a practice like this, that trying to reach out to people who might be like your raving fans, because then they will post about it on other groups and spread the word that way. So you can just, just personally.
The ones who are my patients I've followed up with, but not the like random, just like, oh, this is a good idea. But it's outside of my comfort zone, but totally might be.
It is all right. Yeah. All of it is outside our comfort zones. We don't learn this stuff. But yeah, just to.
I was not even on social media before this, so it's all very.
Yeah, it's a lot. But yeah, so just DMing them, saying, hey, thanks for your support. I saw that you were interested in some kind of introduction, like, can I tell you more about it, or do you have any questions? Something like that. Just leave it open-ended.
Okay.
And not everyone will answer, but some will. So we were talking about your ideal patient is what we started out with. Yeah, so I think that if you can, that mom, the multi-generational family, trying to really just kind of think about other places where you can meet them or you can interact with them, that would be good. And then trying to kind of just keep coming back to that particular thing and looking for more people who might fit. And just remember, how many people are you trying to get? I mean, how many What's your goal? Yeah,
250 to
which is a
300. Yeah.
nice, it's a really nice number, I think, for moms in particular.
Yeah.
Like, that's good. I think that's a really good space. Okay, and then we talked about how to do the meet and greets and how to give everyone time. It's hard, especially it's just you, right? You don't have anyone.
No staff.
Yeah.
No.
Are some of them your patients already though, right? Okay.
Yeah. So those will be
Those are
fairly
easier.
easy, I think.
So one thing that somebody did mention, it's Dr. Adame. She's a pediatrician. She's doing group meet and greets, which I thought was amazing.
Oh, I did read. I read
Yeah.
this somewhere. That would, because like today I have 12 back to back to back to back, which is just
Wow.
like, I mean, a great problem. And
That's
also like I'm gonna
exhausting.
be, yeah.
Wow.
I did like 8 last week and I was like, oh, how am I gonna do 12? But here we
Wow.
are.
Yeah.
Um,
Yeah.
yeah.
Wow.
So groups might be,
A group would be nice. So,
and maybe, yeah, I feel like I'm already scheduled like through the end of January, but maybe then once I'm open, just doing like every day
mm-hmm.
at noon, we
Yeah.
have this thing.
And then
Okay.
another thing is you can advertise it on Facebook and Instagram or just social posts, not necessarily paid, but if you wanted to do like a Zoom call or some kind of webinar, and then you record that and
And
then
then
you
you could
post it
just,
on your website.
okay.
Or if you want to have a YouTube channel, I mean, you don't even have to have a lot on there, but you can just post it on YouTube. Some place where people
Yeah.
can access it because that's another easy way. That way you're not one on one and it's
Yeah.
accessible anytime. If it's 12 o'clock, midnight, people want to watch it, they can. So that's an
Hmm.
easy one too.
I've been a little bit hesitant just because, like, I want the vetting to
Sure.
go both ways. And so I like the idea of the one on one as a chance just to feel them out and me out. Yeah. And so I'd be curious in the group setting if you could still get that vibe. That would be
Or you
harder.
can call it more of an
I suspect it would be
informational
harder.
group call.
True.
And then
Yeah.
still, because that will weed out some people if they hear more
That's
and then
true.
it's not for me.
Like,
I think,
ooh, yeah.
mm-hmm,
Then if they go to the next one, then
right,
they're going to have,
right. So
yeah,
that
more
you can
buy-in.
still do kind of just a real quick meet and greet. And you may want to be able to schedule them so if they've already gone through that kind of one initial kind of group call that you could easily
Hmm.
convert it if you decided, okay, we're a good fit. Yeah,
Let's do it.
yeah. So that
Yeah,
you
that
can
would be okay. So I can
schedule a
input.
little bit more time so that if it works, great. If it doesn't, okay.
Yeah, that's not a bad idea.
Yep.
Yeah.
But yeah, I think that would be an easier thing for you because that's a lot. 12, gosh. Yep. The onboarding, I think at least for your people that you already know, if you just, and you're almost done anyway, but just kind of like tuck them away for a little bit and then you can bring them back in another couple months when, when they need you.
Oh, that's
Yeah.
not a bad idea.
But I would try
Yeah,
to encourage them
it
to,
didn't have as
yeah, I
many
try to
seasons.
encourage them to sign up though, not to wait
Hmm.
until 2 or 3 months.
Yeah, I guess that's it. It's like I have this like, oh, if you're enrolled, you need an appointment right away. But maybe, yeah, for these people that like I've been seeing regularly and they don't have any acute issue, like I don't necessarily
Right.
need to see them the day
Yeah.
I open.
So the ones that
Yeah.
are your patients that are coming with you, some may
Hmm.
feel like, I don't need you for 3 months. I'm not going to sign up for 3 months. But what if they do need you, right?
Yeah.
They will sign up then. But
Yeah.
what I would say is probably giving them some kind of incentive to sign up now. So, do you have an enrollment fee? You don't. Okay.
I don't. Yeah. No. Yeah. So I don't
The
have that
carrot. Yeah.
carrot to.
Yeah. Or you could say something like, well, your first month is 50% off or something for your previous pay. And privately
Something.
say it
Yeah.
so that not everyone knows
Yeah.
it,
Yeah. Yeah.
but at least they'll
No
say,
sense.
oh, okay, well, it might work. I don't know. You don't know
Yes.
till you try it. And that's the great thing about having your
Yeah.
own business is like, it
You can
doesn't
just.
work. Okay, well, let's change it.
That's good. I've been trying. I don't know. And this is again like I just need to get over it. But like all the gimmicky like first whatever free or this if you're the first number of X. Like I just am so off put by that I've tried really hard to just be like, this is the price. This is the whatever. It just is. Take it or leave it sort of thing. I can see how that sense of a
Right.
little bit of urgency to get people that they just know. And I've even said that to patients. I'm like, why am I saying that when they're like, oh, I don't know. And I was like, okay, well, if you decide next year, it makes sense. I'll be there. I'm like, why am I saying it like that? I'm just this commodity, but it comes out of my mouth. So,
Well, I
yeah.
mean, there's nothing wrong with saying that. I mean, but especially if that person is not your person. If they're not,
Yeah, no, but I think it's the people
oh,
that
got it.
are my
Okay.
people that I really, the kind of people that I really enjoy taking care of, but aren't the ones we were talking about earlier who oh, I thought you'd be the one that would be right on this and you're not. And then I feel some oh, well, I'd love to, and it's true. I would love to take care of them a
Sure.
year from now. Yeah, some way to kind of get but if you sign up now, it would be great for
Right. Yeah.
everybody.
Yeah. Well, definitely the people who you've talked to at your practice and they're like, yes, I'm coming to see you. It's trying
Yeah,
something to some kind of urgency.
I feel like most of those people are either have pre-enrolled or have communicated to me that they're planning to pre-enroll or scheduled for a meet and greet because they have some
Mm-hmm.
questions because I'm not requiring meet and greets for
Yep.
my prior patients. So I feel like most of those are just getting it with this is just what I got, but
Yeah.
we'll see.
Yeah.
Yeah.
Well, it sounds like you're on your way. This is amazing. It's wonderful.
So
Yeah.
yeah,
Yeah. Some people start with no patience. So this is great. You're ahead of the
yeah,
game.
it's a good problem to have. I just want to do it right from here.
Well, right or wrong,
Not gonna mess up.
who's to say if it's right or wrong? But again, if it doesn't work out, whatever process you're using, you can change it easily. No, you're the boss. You get to
Yeah.
do it. So you don't have to ask anyone for permission.
Okay.
You don't have to ask anyone for permission. If it seems like something else would work better, then you can do it. It's a big leap.
Thank
It
you.
really is. It's so hard to because a lot of us have never been the boss, and there's always someone else to look up to, and it's kind of now you have to really adult.
I realize I've always had so many people to blame things on in corporate healthcare, and now I'm I have nobody to blame but myself, which is
Mm-hmm.
really empowering and
Yep.
also really terrifying of who am I going to point
Mm-hmm.
the finger at when
Yeah.
something goes awry?
It's a learning experience, and if it doesn't work out, just pivot, adjust, try again. That's all you can do.
I will do that.
You're
Thank you so
welcome. I
much.
hope that was helpful.
It was,
Good,
yeah.
good. All right. So let's see. Tell us again how people can find you if they did want to talk to you, if they're in Oregon and maybe someone else is like, I want to do DPC, and they will come to you and ask for help. How can we find you?
Yeah, the easiest way to do it is my website has all my info on it, rooteddirectprimarycare.com.
Wonderful. Well, thank you, Alisa. I appreciate your time, and thank you for being willing to share, because that's a hard thing.
Yeah.
It's very hard to kind of just lay it all out there. So I really appreciate you coming on and sharing with other people. And I know other people are going to learn from this. So it's great. Thank you.
Thank you so much for having me and sharing your wisdom with me. I
You're so
appreciate it.
welcome. Thanks again for listening to DPC Life. If you are thinking about opening up your own direct primary care, please take a look at the 5-day confidence course that you can get by going to Instagram and sending a DM with the word course, and we will send you the free 5-day DPC confidence course. It's a short set of emails that gives you some small steps that you can do to help get you closer to opening your direct primary care practice. And also, like I said earlier, keep an eye out on the DPC Life social media pages for information about the mini mastermind that we'll be hosting in February. Thanks again for listening, and we'll see you at the next episode. Thank you for listening to DPC Life. If today's conversation inspired you, hit follow, leave a review, and share it with a friend who's ready for change. Remember, wherever you are in the journey, your DPC family has your back. Until next time, keep building a practice and a life that truly fits you. This show is brought to you by DPC Ads and Minutes and Harmony Ops Health, helping independent doctors like you grow and thrive.